Hi everybody, it's Tuesday, January 20th, and I'm giving my legislative update from the West Virginia State Senate. And I guess life in the State Senate is proving to be quite a bit different than in the House of Delegates. Each day I keep thinking I'm going to have a little bit more free time, and it proves to be yet another busy day. So we started off the day this morning at around 8 o'clock. We had our Northern Panhandle Caucus, and for those of you who don't know, the Northern Panhandle Caucus was formed by delegates and senators years ago in the Northern Panhandle, and it's just a way for all of us members of the legislature from the Northern Panhandle to get together and discuss anything that might be important to us as a region. And it also gives us, it's a way for us to have more influence on a particular issue. If we kind of stick together and work together on something, we can have a bigger impact because our numbers are greater. So we had our caucus this morning, delegates and senators from Hancock, Brook, Ohio, Marshall, and even Wetzel County, Mon County. Senator Leonhardt was there. And this morning's presenters were from the Wheeling Health Right Free Clinic. And that is something that many of you might not be familiar with in Wheeling. All around our state we have free clinics that provide care basically to the working poor. And it's those folks who kind of fall between the cracks, may not qualify, may not have previously qualified for Medicaid, but didn't have adequate insurance. And their major concern this morning was that, as a result of the governor's budget that he put out that showed 52% in budget cuts to free clinics. And what they're explaining to us that's a lethal cut to some of the free clinics, and some of them will simply have to close down. Wheeling's one of the larger clinics that services the whole Northern Panhandle. They have a little bit larger budget, but they're essentially saying that anything over 20% is closing time for free clinics, and there's a lot of work that's gone into it. There's a ton of value and benefit healthcare-wise to our community as a result of the work that they do. And so I think that was really useful for us to hear that information, especially those of us who are new to the legislature, to hear that, understand what that means for the Northern Panhandle. So appreciate them coming down, Kathy Brown and everyone from the Association of Free Clinics. Concluded that and had our first labor meeting this morning at 10 o'clock. Originally had on there Senate Bill 245, which was a repeal of prevailing wage in the state of West Virginia. That was something put on the agenda by our chairman, but was actually ultimately decided to be taken off for further consideration. So apologize for anybody who might have been here in anticipation for that today. It's going to be a little while, I think, if at all, if we see that back again here in the Senate. After Senate Bill 245 was removed, we had Senate Bills 153 through 158, were just rules bills from the Department of Labor, which I kind of explained in a previous video update, is when an agency is authorized to promulgate a rule based on a piece of legislation that we pass. So not very controversial, passed all those without any issue. And then, of course, at 11 o'clock, we had our floor session. We had two bills on second reading today. And just to give you a little bit of background, for those of you who aren't familiar with the legislative process, when a bill is passed out of committee, it then goes to the Senate floor. The bill has to be read on 3 separate days on the Senate floor, and that gives everyone time to consider the bill and make sure that they have a full understanding before voting on it. It's also procedurally on the second day is when amendments are offered. And so today would have been amendment day for either of those bills. One of them was Senate Bill 1, which we've talked about here before on our legislative update, which I said is often referred to as the cap and trade bill, repeal of the cap and trade bill. And then the other one was another one that I talked about. We passed out of the Judiciary Committee, which was Senate Bill 3, which was the landowner's liability for trespass or harm. I think I talked about that on Friday, that we had passed that out of the Judiciary Committee. It was on second reading today on the House floor. After we finished up the floor session, I had a nice meeting with some folks from the Northern Panhandle, representatives from the West Virginia Conservation Agency. One of them was Wheeling's own Bob Luchetti. Appreciate them coming down. It's always nice to have visitors from the Northern Panhandle. I don't see them too often all the way down here in Charleston, but they were basically talking about what the Conservation Agency does, what its role is, and one of their major concerns today was about dam maintenance. They're obviously also feeling the budget cuts that we're continuing to have this year and their concerns with that, and they were just kind of informing me on the other issues that their agency addresses. So appreciate them coming down and enjoyed talking with them. Right after that, around 2 o'clock, we had the Government Organization Committee meeting, which I serve on. There was a bill here that I think might be of particular interest to those of you who follow our Senate Facebook page. Several of you have made comments about being unhappy with the performance of the Division of Highways. We had Senate Bill 8 today in Government Organization, and the bill title was Division of Highways Performance and Efficiency Audit. Unfortunately, there was a few concerns raised there. We've laid that bill over. We put it in a subcommittee rather until the next meeting because it lacked a fiscal note. Some of the members of the committee raised the concern about a lack of a fiscal note, so we're going to wait a couple days to get that to find out what the cost of that potential bill might be. And then after that, we had another series of rules bills related to different state agencies. Nothing controversial. At 3 o'clock, following that, we had a Judiciary Committee meeting. We had Senate Bill 43, which is limiting of tolling of statute of limitations for third-party complaints. It's basically changing the time frame for which a complaint reaches a statute of limitations. Following that, we had Senate Bills 173 to 177. Again, more rules bills. Actually, these were bills that I had seen in my health committee. We had passed out of health. They were second referenced Judiciary, and so we passed those out today as well. Wrapped up the Judiciary Committee, got back to my office and had a discussion with some of the local media in the Northern Panhandle about the possibility of introducing a bill related to the exemption process for vaccines for students entering school in the state of West Virginia. And this is an issue that I've worked on for several years in the House of Delegates. It's obviously is very, very concerning to me. In my opinion, we have somewhat of a broken process in the state of West Virginia. I think we need to make some improvements to that. I've been working with different interested parties from around the state and the Bureau for Public Health here in Charleston. And so I was responding to media's questions about that particular bill, the potential for that bill, which I have not yet introduced, but am considering introducing at some point this week. So I think that wraps it up for today. I will talk more about that bill in the coming days, the vaccine exemption bill, as we get further along the process and get ready to introduce something. So we'll see you all tomorrow. Thank you for watching.